I'm just going to admit there. I'm just waiting for somebody to join and then we will kick off. Good morning, everyone, and welcome, Natasha, to our second talk, this time about the B vitamins and all the amazing benefits, incredible information that you've already shared with me that we're going to be looking at today. And for those of you who will be watching the recording, thank you so much for taking time to join us for that. We realize it's a tricky time for people who are at work to set this time aside, and we will look in future to maybe make it a different time. But I want to just tell you how excited I am as a health practitioner to be having these types of discussion. The benefit of this for you, whether you're a practitioner or not, is that either you will be refreshing your own knowledge, sort of just reminding yourself of certain things as far as nutrition goes, and then for the clients or the patients to get a really high level insight into the benefits of certain nutrients, and today specifically the Bs. So hopefully this will also help to empower you, because knowledge is so important when you're having to make decisions, going out shopping perhaps next time for a nutrient, to be able to read the label and look at it completely differently. So without further ado, I'm going to hand over to Natasha just to introduce herself, and then we'll kick off with our discussion for today. Thanks, Natasha.
Morning, Em, and thank you so much for having me chat to you again on this beautiful morning. You know, I enjoy our chats so much, and as I've said before, we go back many years in our functional medicine, functional nutrition journey, and it's just so exciting to have these chats and share some of what we know. And like you say, whether it's practitioners that are joining us or clients that are listening, really all this is to help patients become empowered. So when they standing in the pharmacy, or when they're actually sitting across their physician, they are able to ask intelligent questions, and they're able to make the best decision with their caregiver for their particular health. But a little bit about me, for people who don't know me, is that I am a qualified homeopath. I practiced for a number of years, and I am fortunate enough to work with a company called AmiPro, and we are really, we've partnered with global leaders in nutrition and in the nutrition space. And I spend 80% of my time talking to practitioners and introducing them to one of my passions, which is nutrition, and trying to bring nutrition back into the consultative space. And more importantly, then trying to get our practitioners to then carry that through with their patients and educating them. Because as you know, Emma, in nutrition, there's no one size fits all. And I also think that the nutrition conversation is so lacking. And ultimately, it's people like myself and the company that I work for, AmiPro, and then people like yourself, practitioners like yourself, who are kind of holding that space, bringing it back down to basics. And at the same time, I truly believe changing lives. So I'm excited to be, and I'm excited for our topic this morning. And I'm sure it's going to add value.
I have no doubt that it'll add value. What I thought I'll just do from a practitioner's point of view, and also a previous health store owner, my concerns were always, when I looked at what people were told or advised, if they didn't have a practitioner to assist them, they would go to a chain store or a pharmacy with their sort of request for something to help them with energy, or maybe with depression or anxiety. And unfortunately, the level of advice that they were given was never really tailor-made for them. It was never really based on understanding their health history or understanding their symptom profile. And then I often used to hear from these clients or customers that they felt disillusioned, that they said, oh no, I've taken Bs before, or I've taken this before, or that before, and it didn't work for me. And what I got to understand was that they were taking either a product that was poorly formulated or that perhaps had too low levels of these B vitamins or the nutrients in question to meet their requirements. So I think it's so important to understand how specialized it can be without having to make it complicated. But it's not that if you've taken one B complex and it didn't work for you, you must never touch it again. So I think that was also part of the background why we felt this chat could be helpful. So Natasha, please share with us some of the.
I want to add to what you've just said very quickly, Em. I agree with you. I think if we can get people to the point where they understand that nutrition is essential, that's a small part of the battle already won. The next step is to then teach them how to optimize that knowledge and how to use it for their betterment. And so a lot of our patients do. I mean, when I was in practice, I would say every second patient that arrived at me, they used to bring their Checkers or their Pick and Pay plastic bag full of nutraceuticals and, mind you, prescriptive medication, and just kind of dump it on my desk. And I would spend a large part of that consultative process just wading through masses of vitamins and minerals and herbs, and then obviously trying to understand what the prescriptive medications are, what the different interactions are. So it can be overwhelming for patients. So the first step is get them to understand that nutrition is essential. And obviously we know that a good diet is the foundation. So we're talking in the context today of a patient who is already with a practitioner or in a therapeutic situation where they are being coached on what are the right food choices for them to make. And then the second thing is, okay, if we want to now optimize that and you do want to begin experimenting with therapeutic supplementation or even foundation care supplementation, where do you go to and what are the things that you need to look for? And most patients identify with B vitamins. Most patients, when we see them in practice, are on a B vitamin of some sort. And I thought it was a good place to maybe start in terms of what do we need to look for when we want to embark on this supplementation regime for ourselves. And so let's start with B vitamins. So B vitamins are an essential class of water-soluble vitamins. There are about 8 of them that we really need, as you know. And the good thing is they are water-soluble. So from an absorption point of view, typically we don't have too much problems, unless in some situations, as we'll see later on, and I think the big theme is we have issues with stomach acidity and gastric or gastrointestinal functioning. You might then run into some trouble with the absorption of the Bs. But for the general person out there who's already healthy, they're already changing their diet, they're doing a paleo or a keto, or they're in some kind of therapeutic situation with a practitioner, chances are that they're probably going to get sufficient absorption. So we don't need to put the Bs into a special form necessarily, but what we do need to make sure is that we're taking Bs that work well with the body's processes. But if we just take a step back, someone asked me once, why are the B vitamins called B vitamins? And I honestly could not answer them. So I made sure next time I would be prepared. And it's actually quite interesting. There were a few scientists in the late 1800s that started to notice that there are key elements and substances in foodstuffs that either promote health or the absence of which would promote disease. But it was a specific scientist, Dr. Funk. I love his name, Dr. Casimir Funk. He was a biochemist and he practiced with a Polish biochemist, and he practiced in the early 1900s. And he was one of the first scientists who actually discovered that, or discovered B1, vitamin B1. And how we discovered it is because they found that people that ate white rice or refined rice were developing a disease that they termed beriberi. And beriberi it's associated with weakness and weakness, weight loss, and can actually lead to death. So, and back in the day, it was a serious concern. But they found that if the people ate brown rice, that they didn't get beriberi, they didn't get this presentation. And then he was the first person to isolate thiamine B1 from the husk of the white rice. And actually he returned to the hull or the husk of the white rice numerous times and found out that, oh, there's such a thing as niacin, vitamin B3. But basically what he did is because the thiamine, the substance, cured beriberi, a disease that began with B. He just called it B1. And then from that point onwards, when they discovered Bs, it was literally just in order of discovery. So B1, B2, B3. So really nothing to do with science as it was in terms of what the B can do. But just that's why they're called B vitamins. And it's a term that's stuck. And I just think it's so apt because, if you think of the ABCs of anything, the B's are such a crucial part of everything. You should always make sure you have your A, B's, and C's every day. Your vitamin A, your B complex, and definitely your vitamin C. But we're going to focus on vitamin B today. And yeah, hopefully someone will learn something. So what causes depletion? I mean, a big obstacle to overcome, and I think we've overcome it to a large degree, is this notion that if I eat a balanced diet, do I really need to supplement? The research surrounding that is very old. We know from the 1990s already, with loads of published research, that yes, there is a need for supplementation. Why would you not want to optimize your diet if you had at your disposal really amazing formulations that could potentially starve off disease and prevent chronic polyprescriptions? I mean, why would you not? And the infamous Dr. Atkins in his Vital Nutrient Solution book, which was one of the books that kind of changed the trajectory of my practice years ago. I mean, he was quoting research from the early 1990s where it's irrefutable the value that a really good nutraceutical complex can make, not just as a foundation, but for someone who is actually ill and has a particular concern that they want to address. But the majority of our patients are not eating a well-rounded, balanced diet anyway. So the problem is they land up with a practitioner who is very proactive in the nutrition space, and very often that's the only tools we have to work with. We don't have access to prescriptive medication. The person's probably been on prescriptive medication for many years, and then we really only have nutrition to rely on as a intervention. And so the balanced diet that we then prescribe for that patient, that we coach them, we hold their hand, we teach them how to employ those dietary changes, then become the foundation upon which we would then very selectively choose the nutraceuticals to aid whatever it is we need to achieve in that patient. But the non-balanced diet is probably the most obvious place to look at. So our vegan patients, especially our vegetarian patients, we know that when it comes to B vitamins, that these are the patients that are going to be at greater risk. So if we do have the privilege of helping a person who's vegan or vegetarian, then really all we need to do is make sure that they are supplementing with a really good B complex. Excessive alcohol consumption. So that, they say the word excessive, but what is excessive? So if you have a glass of wine every single night, it's excessive. And we do know that we're going into the Christmas festive season now. So, people are going to relax a bit. They're going to enjoy themselves a little bit more. So around this time is probably a good time for us to supplement with our B complex. Various medications, as I said before, when patients arrive with a bag full of poly prescriptions, you can almost assume that there's going to be a B vitamin deficiency. So if anyone is taking common things like metformin, which most of our diabetics or insulin-dependent patients on, women who want to lose weight are often placed on metformin, proton pump inhibitors for reflux, even hormone replacement therapy. In fact, I would say hormone replacement therapy, HRT, probably has the single most biggest effect on vitamin B depletion. It depletes pretty much most of the Bs in the B complex. So if any woman is taking hormone replacement therapy, then she definitely is going to need her B vitamins to be addressed. And then common things like diuretics, blood pressure lowering medications, antipsychotics, antidepressants, all of those, even anti-epileptics, children that are placed on anti-epileptics to manage the epilepsy, all need to be supported with a B complex. So really, every patient that walks in is a person that is likely to going to benefit from a good B complex. And then, in some patients where there's gut malabsorption syndrome, so things like ulcerative colitis, celiac disease, even irritable bowel syndrome, patients who had gastric bypass surgery. So all those concerns need to be addressed. And then, all disease begins and ends in the gut. So for most part, people have issues with their stomach acidity, which I'll show you in the next slide. And for me, when I was kind of looking at B vitamins, some of the themes that stood out was definitely this theme around stomach acidity and stomach function and health. So we always talk about the gut and gut health, and often people kind of associate that more with the lower digestive system. But our stomach is so important. And I would say at least 1 in 2 people that walk in to your practice, certainly my practice used to be the case, they would have GERD or they would have any other symptom of low stomach acidity. So we're looking at things like constipation, bloating, a sensation of fullness, and those common symptoms associated with having low stomach acidity. Stress is a huge thing. So no one is immune to stress. They might not feel distressed, but their body is straining back every day. So with regards to our stress response, it uses up vitamins significantly, especially things like our vitamin B5. And if we don't replace that, then our stress tolerance becomes less. So if we become overstimulated, irritable, moody, short-tempered, it's a sign, it's an outward sign that we need to replace our Bs. And then the aging process. So as we get older, there are certain things that happen with our enzymes in our body, and we're not able to switch things on very well, and then that can cause disruption in or an increased need for B vitamins. So the aging process is something that none of us can escape. So definitely all of us, as we with advancing age, are going to have to look at supplementing with some sort of B vitamin. But these are things I'm sure, Em, you see in your practice every day. So, and at the very least, patients need to be open to considering a good B complex. So not all Bs are created equal. So as you know, as I did disclose, I do work for a company called AmiPro. We have chosen to align ourselves with a company called Metagenics, which a lot of practitioners know. It's one of the preferred brands, practitioner brands. And but really, Metagenics, being a global company and being the preferred provider to practitioners in the functional nutrition space, pretty much, they're going to produce a B vitamin that's sort of unequaled, that kind of stands alone and is going to give you what you need at the right dose, in the right form. And it's very important for patients to understand that, because when we script a patient, say, go and take a B complex, and they land up in a corporate pharmacy or even in a health food store, wherever they are, and they are bombarded by shelves of B vitamins, how do they choose? And it's important for us as practitioners to educate a patient, when you pick up a label, this is what you need to look for. So I'm hoping with that slide, we actually can educate the patients as to what they need to look for. I mean, Em, I'm sure you do this. I'm sure you sit with your patients.
Education for me is always such a big part of a consultation. And I always ask my clients to bring the products that they have at home so that we can look at that to see whether we can actually use it or work with it. But then also, if it's the average B complex that you'll be buying from, and I really don't want to be mentioning names, it's not about that, but it's just then to compare to something like this and to say, okay, can you see, for example, there's only 1.25 milligram of each of the main Bs. Now, if I'm sitting with somebody who's really tired, they're so fatigued they can hardly get out of bed, they struggle to get through the day, they have to rely on coffee and all sorts of things to help them. And how I usually explain to them is that if all 4 tires of your car are flat, you're not going to just put a little bit of edge and now expect that tire to be well inflated. And the same with B vitamins and depletion. If somebody's really exhausted, you can't give them the tiniest bit of each of these main Bs and expect that to make a difference. It's not going to make a difference. And then I also have, and in the context of this and the label and what people think is the same, I often have people who have injections of a very popular brand that was actually originally designed for neuropathy. So it's B1, B6, B12, really nice high doses, but they have that once a month. And then they think that that covers their B vitamin requirements. And one has to then understand that if you're taking 3 out of the whole 8 blend, and you take it once a month, it can't exactly do everything every day for you. So that's just been the sort of common things that I have come across.
And it's so true that with nutritional medicine, the dose is so important. And the label, this product, this is from our product called Glycogenics, which is our B complex. And this is a foundation product. It's not really designed to specifically treat any kind of illness on its own. But when you understand the physiology of B vitamins, that they work together as a group. I mean, B vitamins in nature are found together. They're not found individually. And it's important to get the message across that, like with the injections, and there are other products out there that don't have all 8 of the vitamin Bs listed on the label, or they have such negligible amounts that it's not really going to make a contribution. It's important for patients to understand that the B complex works as a unit. And if you start removing single Bs out in very high dose, you actually have potential for side effects. So natural medicine or nutritional medicine, as you know, is not without side effects. I mean, people kind of assume it's natural, therefore it can't make me sick. But in the wrong hands, in the wrong dose, and out of context, people can get all kinds of things happening, especially from something as active as B vitamins. So this is what patients need to look for. I've kind of highlighted the Bs that are very important, but there is your vitamin B1, thiamine, B2, riboflavin, niacin is B3. You've got your B6, pyridoxine, your folate, which is not the same as folic acid. So I highlighted this in green because that's the first place to look for, is when your patient is scripted for a B complex, or they bring you a B complex, that it's not folic acid, that it's folate, right? And those are 2 completely different things. Folic acid is not metabolized very easily in the body, as I'll show, whereas folate, especially in the form of 5-methyl tetrahydrofolate, is definitely the type of preferred folate that most of us need and most of us can use. In fact, 6 out of 10 women that walk into our practice cannot access their folic acid. Yet it's the go-to vitamin when they're pregnant. It's the vitamin they need if they're on any hormone replacement or if they're on the pill. So certainly one of the things, especially if you're dealing with a female patient, is that they need to look for folate and not folic acid. If it has folic acid, just put it back. The other thing is vitamin B12, so methylcobalamin. Not cyanocobalamin. So the form of B12 is equally as important. So it's really crucial that we look at the type of B12, because B12 and folate are the power couple. as it were, of the B complex. And without them, we really can't achieve much. Then we've got biotin, which most people know. And unfortunately, a lot of women are supplementing with super physiologic doses of standalone biotin because they want to grow their hair and they want to shrink the pores on their face. And whilst biotin is good for all those things, taken out of context, it's not as great. It requires fatty acids and it requires the other Bs, especially B6, B3, for its functioning. So if a person is, for instance, taking, I've seen like 5,000 milligrams of biotin being sold, then it's fine, they can stay on that, but they definitely need to just supplement with the rest of the Bs. Then we've got our pantothenic acid, and again, in fairly high dose. So all the things that are in green are highlighted in this formula because we've kind of put them at a much higher concentration than you would normally find in most other B complex vitamins. And pantothenate, as you know, is our stress vitamin, which I'll talk about if I can later. And then we've added other things in here. Choline, not a B vitamin, but we added in because the B vitamin as a group also needs support, and the choline actually enhances what we're trying to do with the B vitamin, especially when it comes to cardiovascular health, nervous system health. There's also a little bit of myo-inositol in here. So myo-inositol is a huge thing for brain health, depression, energy, anti-inflammation, supports the B vitamins and supports the choline. And then we've got PABA, which is often included as part of a B complex, but it's not really part of the essential core group. But PABA in its own right is a fantastic addition, especially for skin health and skin problems. And then we've added a little bit of vitamin C in here as well. So this would be an example of a B vitamin that's worth your effort, because the core vitamins are there and they've put them in reasonable doses. So we can expect to not just treat deficiency, you can actually expect to support and optimize health rather than just preventing the diseases associated with B vitamin deficiency. And the glycogenics is really cost effective. It's not a very expensive product. The label you see here is per 1 tablet. So what you're seeing is per 1 tablet. So I would say for patients to kind of use this kind of label as a yardstick. And this is what you need to look for. These are the kind of dosages that would be reasonable to start with, and we would see a difference with, and to make sure that the different forms that we're seeing is what's on the label. And hopefully from there, they're able to then discern for themselves if, what a good B complex is. I mean, you work with this B complex in your practice. And I think, just from the feedback I get and from the patients I've used it on, there's very little side effects, there's very little flushing, there's very little headaches, there's very little issues really with the B complex as a whole. So it's a really nice one to work with. And one of the biggest results you're going to get from a balanced B complex like this is energy. It's the first thing that changes, is fatigue really lifts. And the second thing is mental performance. So whether that's cognitive performance, whether it's mood stabilization, those are the areas typically that improve very quickly if you're taking a B complex that's well-rounded.
And I think that often is also the misperception. People think if you're not tired that you don't need to take a B vitamin, and we forget. So when I say that, I almost mean like people think you only take B vitamins when you are tired. That's their function. But in fact, they're part of so many enzyme processes in the body as cofactors. So it's not just something you take when you have a symptom. It's almost part of what's daily required just to run the body.
Well, an example is B1. It's called the great mimicker of disease because if you're deficient in thiamine, for instance, it can present in so many different ways. So one of the things that stood out for me was preeclampsia. I mean, I wasn't really aware of it until I studied B1, is that women who are pregnant and are B1 deficient, because we know that pregnancy is such an easy stage in a woman's life to become nutrient deficient. When you are deficient in B1, it increases your risk for toxemia and pregnancy. And just making sure that our female patients who are pregnant have adequate B1, you can actually prevent that. And baby can go full term, and you can prevent all the complications associated with becoming preeclamptic. But other things, for instance, things that are just like strange, like vertigo. People that have vertigo, or people that have postural hypotension, for instance, which are things that are difficult to treat typically. Vitamin B1 is often the solution for that. One of the main things that vitamin B1 does is it works in our mitochondria. So mitochondria are the powerhouses inside the cells, and they are basically the places where the food that we eat get converted into energy. So they're really important, and we need to look after them. Now, the 5 main enzymes, which are like little keys that unlock the functions of the mitochondria, rely on thiamine, vitamin B1. So when we don't have enough B1, we feel tired and fatigued. But interestingly enough, people that can't tolerate exercise, which I think is probably most people, at least mentally. But if you have a patient who recovers poorly from exercise, it takes them 2 days to recover. They get a buildup of lactic acid that they just cannot shift. Or they just feel weak when they do exercise. That is a quick sign that potentially there could be a B1 deficiency, because when you start exercising, your mitochondria have to start keeping up with energy production so your skeletal muscle can perform. So that weakness, that apathy, that ineffectiveness during, after, and then the lactic acid that sort of lingers for 2 to 3 days should be a clear sign that there's B1 deficiency. I saw a lot of that in practice, because what do we do as functional medicine practitioners is we try and encourage patients to move. Begin to use your body. You don't have to run a marathon, but go for walks, introduce resistance training, get your cardiovascular system fit again. And then very often we have to tap back because the patient's tolerance of exercise is so poor. And when you see that, even as a practitioner, it should alert you to an increased need for thiamine. So you could potentially then go in with a high dose thiamine on its own, like a 200 milligrams, just to support that early transition and mitochondropathy. But you cannot do that without a B complex. So you do need your foundation B complex for that. The other thing that vitamin B1 does is it helps our diabetics. So patients with diabetic neuropathy. So, when you got the burning and the tingling and eventually the numbness, B1 is so amazing because it takes the glucose off the nerve. It stops that glycation so that your nerve can regenerate. So we know that diabetes is such a huge thing. And so B1, absolutely, if you are pre-diabetic or diabetic, you are likely deficient in thiamine. But other things, edema, how many times do we have patients who have just swelling of the ankles? There's nothing wrong with their heart necessarily. And many of them don't even have hypertension. Many of them, the thyroid comes back normal, but they've just got this kind of swelling that occurs, again, B1 deficiency. So a lot of things. Interestingly enough, nightmares in children, panic attacks, insomnia. So like you say, it's not just a lack of energy. If we're just looking at the first B vitamin of the B complex family alone, there's so much need for it. But I do want to highlight a theme that I've noticed, and I have alluded to it before. So you cannot, so vitamin B1 is required for stomach acid production. Mm-hmm. It is very common to have patients arrive at our rooms with GERD or symptoms of reflux. And if there is reflux, chances are this patient is B1 deficient. Now, I want to just show you this diagram. So this is the stomach, just for patients who are not familiar with this. That's your esophagus. There is a valve here between the esophagus and the stomach that only closes properly if the stomach is acidic enough. It has a little sensor that detects the pH. And if the pH of the stomach is too alkaline, it actually can impede this valve's closure, which can then obviously cause refluxing up. So you need a good amount of acidity to stop reflux. Now, thiamine, vitamin B1, helps the stomach to make stomach acid. So if patients are refluxing, chances are that they are deficient in stomach acid. There are many other things as well, but a good place to start is just to supply thiamine. So again, you might not be tired, but if you're having any kind of symptom associated with GERD or reflux, chances are that you need a good B complex. You need thiamine, and because you need thiamine, you need the other Bs.
Mm-hmm.
And then again, vitamin B2. Vitamin B2 makes all the other vitamin Bs do what they need to do. So if we are deficient in B2, even if we take all the other Bs, we're not going to really get the effects of those Bs. One of the things it does, or two things actually, vitamin B2 is responsible for switching on our vitamin B6, which many of us cannot do. It's also responsible for activating or converting folic acid into its active 5-methyl tetrahydrofolate form. So without vitamin B2, at the very least, your B6 and your B12 does nothing for you. And it's so interesting, Emma, that vitamin B2 also recycles glutathione. So the Bs actually will help other vitamins in the body. So glutathione's like a buzzword now. Everybody's receiving it intravenously because they want to brighten their complexion from the inside out. But we do know that glutathione is getting a lot of attention with regards to its antioxidant benefits and its assistance in so many inflammatory conditions. And many people do have issues with glutathione production, as you know. But vitamin B2 regulates or recycles glutathione to such a point that in the earlier days, they used to use vitamin B2 levels as a marker of glutathione bioavailability in the body.
So interesting.
Yeah. So if you have
often
any
forgotten.
patient,
If
you have any patients who are taking glutathione or they want to enhance their glutathione, then the B2 would be essential.
And then I just, the NTHFR enzyme, here we're talking about homocysteine, and I know you're going to tell us a little bit more about that. Again, I think there's for me, there's such an appreciation of how these vitamins play such a big role. We totally underestimate the working of something. NTHFR is a big word, but when you share with us about homocysteine, I think the appreciation for how something like this can help to speed up or facilitate or ensure that it happens in its proper way. It's so good to do this kind of talk and just revisit
Yes. Just look at the individual Bs and just explain to patients this is why we recommend them and this is why we recommend them together. And I love your analogy you said earlier, just because I'm not tired, I don't need B. But when it comes to something like homocysteine, the silent killer, you don't know that your homocysteine is elevated. You don't know, you don't feel different. So your B complex is a bit like an insurance policy, I would say. It's the very least you can do if you take yourself and your health seriously. If you take the health of your family seriously, your kids seriously, it's the least you can do. But I want to show you this, and so please don't freak out. We don't really need to know everything, but I wanted to just point out two things. So if that is folic acid, which ultimately we don't really recommend people take folic acid, and this is why actually, because to get folic acid to become this thing here called 5-methyl tetrahydrofolate, you can see all the steps that are involved in that. So it's a very costly process, and you actually use up other B vitamins and other cofactors in the process. So taking folic acid, if anybody is listening or anybody listens to this and they're still taking that little yellow folic acid tablet, my suggestion is to go and speak to a nutritional consultant or functional medicine practitioner and get them to change that out for you, because it's not serving you. But even dietary folate in the form of dihydrofolate, at least it's one step less. needs to be converted into this active form of 5-methyl tetrahydrofolate, which incidentally, if I can just show you this label again, this is the form that's in our B complex, 5-methyl tetrahydrofolate. So we've already eliminated a whole lot of steps for you. It's in the body ready, body active version for you. Right, so if we go back to this, what I wanted to illustrate is that in our body, we have DNA, and on the DNA, are our genes. The genes basically are the little recipes for the enzymes in our body. And enzymes are like little keys that open up or open the doors to chemical reactions so that a chemical reaction can take place. So without these enzymes, we can't make things, we can't heal things, repair things, we can't get rid of things in the body. So really enzymes are key to our well-being, but they are governed by our genes and how those genes are read and expressed. Now, between 30 to 50 people will have a problem in a specific gene that codes for an enzyme called methyl tetrahydrofolate reductase, this very long word that people don't really even need to know. But that's why it's on this picture. So 30 to 50% of patients that walk into our room, 3 to 5 out of 10 patients will not be able to switch this enzyme on very easily. And because of that, they will struggle to make 5-methyl tetrahydrofolate. So for that purpose, we've put this in and we avoid that whole gene issue. But this receptor in the body, methyl tetrahydrofolate reductase, that helps us to make the active form of folate, also requires B2. So if you are just taking folate and B12, but you're not taking B2, for instance, you are still not going to be able to make the active version of folate. Now, it's even more interesting that vitamin B2 is switched on and activated by thyroxine, which is T4, your thyroid hormone. So thyroid health is absolutely crucial when we are working with our B complex vitamins as practitioners. We are always going to consider the person's thyroid health. And this is why it's so important for patients to find a coach, a nutritional consultant, a registered dietitian who is well-versed in epigenetics and functional nutrition, because you will consider all these things for that person. I mean, you can't really leave the thyroid out of it and just work with a B complex when it comes to things like well-being. But I just wanted to for the listeners to create that link between thyroid health and how well your Bs work, because if your vitamin B2 doesn't work for you, the rest of the B complex doesn't work as well. But that was just an interesting takeaway for me. And so often, Em, and I mean, you can agree with me, I'm sure, when we see patients, they actually are symptomatic in terms of their thyroid health. They are they're presenting with symptoms of an underactive thyroid, yet their labs appear to be normal.
Sorry, I muted myself because there was traffic outside. I think, even just from that thyroid point of view, when I see clients who are still eating gluten and they bring their thyroid results, which all seem normal, but nobody's ever tested for the thyroid antibodies. And I think that'll be such an interesting a link to explore later on. But if anybody has got any kind of thyroid conditions, I take them off the gluten anyway to just help that side of things. So I think, again, it's like how these things are layered. It's not just always the obvious, but that would be an interesting thing to notice with B2 and
anything that disrupts the thyroid, you're right, will have an impact essentially on methyl tetrahydrofolate production in the body. And for women especially, it's estrogen. If we can't detoxify our estrogen very well, and again, you require B vitamins to do that. So it's all linked. And having a B complex that's in body ready activated form and having all the players involved, I think just mitigates or at least covers all those areas of concern. So no stone is left unturned. But I'm not going to go, I don't want to go into depth with every single B, but I just want to mention a few things with vitamin B3. So vitamin B3 available forms are niacin and niacinamide, and often patients get confused between the two. In the B complex that we just saw, there's a mixture of niacin and niacinamide. So we're covering both forms. Why? Because niacin is very, very important for cholesterol regulation. In fact, niacin touches onto all the issues around hyperlipidemia. So your patients who have elevated LDL, elevated triglycerides, low HDL, and then something called lipoprotein small a. So those are markers that we look for with our patients in terms of our hyperlipidemia, and we track those and we try and get especially the triglycerides down. Now niacin will do that, and you can actually do niacin on its own, but again, I wouldn't do niacin on its own at like 500 to 1,000 milligrams a day if I'm not balancing with a complete B vitamin complex. Why? Because patients can flush. They get that flushing as you get massive relaxation of the microvasculature, the little muscles and the blood vessels, and then you get that flush, and that flush is also associated with histamine release. In the B complex, you've just seen there's more niacinamide than niacin, so we're going to talk to the cardiovascular system, but the inclusion of niacinamide, which is the non-flushing niacin, does take that out of the equation. But for anybody with cholesterol issues, or with cardiovascular issues, niacin is really important. Niacin also will stop unnecessary blood clot formation. So you can consider it as a vasodilator and something that's going to reduce platelets from sticking and clumping and making your blood sticky. And incidentally, the other B vitamin that does that really well is vitamin B6. In the absence of vitamin B6, your blood becomes thicker and it clots. And then interesting applications, everybody's using niacin on the skin, or niacinamide rather on the skin, because it's so good for skin. The increased oxygen perfusion you're going to get to the skin is always going to make vitamin B3 essential for women's health and skin. But lack of vitamin B3 is then associated with dermatitis. So patients have dry, red, flaky skin. We need to maybe consider that there is an issue with niacin. The other place I like to use niacin for is for joint health. So patients who have joint pain. So niacinamide and niacin actually work really nicely because they open up circulation into the joint space. Your joints are less stiff, they're less sore. So, you know, a person that comes in with arthritis or osteoarthritis in particular, they might look at you and go, why are you giving me a B complex? Well, I'm giving you a B complex because I want to at some point perhaps introduce high dose vitamin B3 because we can get better pain control without the effects on the gastrointestinal tract. And at the same time, in patients with osteoarthritis, we do know that those patients need to be screened for cardiovascular health because the osteoarthritis is an early sign that there's cardiovascular issues. So niacin beautifully addresses all of that. The only caveat would be if a person went and just got 500 milligrams of niacin off the shelf somewhere and started taking 2 a day, they'll flush and they might elevate their blood glucose levels slightly. Again, this is why we need things like vitamin B1 and vitamin B6 to keep those glucose levels under control. But I love niacin. It's one of my favorite B vitamins to work with in standalone doses, obviously supported with a B complex. And then vitamin B6 is kind of the star of the B complex, really, if you think about it, because it does so much, especially for women. We do have standalone formulas that have really high amounts of B6, but again, in this formula, B6 is going to touch onto a lot of things. PMS, I'll just say that right out the block, like anybody with PMS. And so it could be premenstrual tension or premenopausal stress. So as you perimenopausing and you're irritable and you've got mood swings and there's depression and there's and sort of moments of psychosis where you kind of look at yourself and you think, gosh, that psychotic behavior. But vitamin B6 is essential for that. It's so important in our hormone regulation. So again, we don't have to feel tired necessarily for a B complex. And one of the things it does, which is interesting, I think you'll appreciate as a dietitian, is it lowers HbA1c. I mean, how many times have we put patients on diets and you measure HbA1c and it's so resistant to coming down?
It's a wonderful benefit to actually appreciate, I think, of the
Yes.
B6.
Yeah, so that glycosylated hemoglobin responds so nicely. And even if you add D3, I think it would be such a good combination. But yeah, B6 is really important. And then you mentioned homocysteine earlier. So homocysteine, for your clients and patients that are going to listen to this and don't know, so homocysteine is an independent marker in the blood of cardiovascular and cerebrovascular health, and actually total body health, because your risk for cancer goes up too as homocysteine elevates. And it's actually quite easy to regulate homocysteine in the body. We really just need a very, very good, well-balanced B complex to do that. But homocysteine is one of those things that you can't have too much of, but you also can't have too little. So the aim here is not to just reduce homocysteine. The aim is to recycle the homocysteine. And so this is what your B complex does, but particularly your B6, your B12, and your folate. So those three work together to regulate homocysteine. So of late, we are seeing an uptick in cerebrovascular and cardiovascular events. So ranging from TIAs to strokes to myocardial infarcts or heart attacks. And so I think it's even more pertinent now to just make sure that all our patients are taking a good B complex, something that's going to give them adequate amounts of the B6 especially. In fact, the Cleveland Clinic speaks to a deficiency of B6 promoting thickening of the blood and increased clotting, which is also another thing that we're seeing. It is a natural diuretic as well, so our antihypertensive or our hypertensive patients do really well on B6 as a antihypertensive, because it drops that volume without causing rebound diuresis. There's so many patients who are taking diuretics, when they stop it, they kind of swell up again. You don't get that with vitamin B6. And then obviously for hormone detoxification, it's so important. And then neurotransmitter production, oh my gosh. So if, you know, norepinephrine, dopamine, serotonin, melatonin, it's such a crucial vitamin. But again, taken on its own, potentially you could cause problems. So and sometimes you can even cause a little bit of a neuropathy-like situation with numbness and tingling if you do B6 on its own. So if there are patients out there who have tried any of the Bs on their own in high dose, it could cause problems. You always need to, you can take it, it's fine, but then go back and support with the B complex at the same time.
What I used to notice, I think because B6 and B12 are, you know, they're really also good friends. And if you take a lot of B6 without getting enough of the B2, that you would start developing the cracks in the corner of the mouth, which immediately tells you, okay, now your B6 has put your B2 out of balance. And
yes,
so your body tells you, and it doesn't take very long for that to happen. So again, sometimes I have recommended B6 for the week sort of leading up to somebody's period or menstrual cycle, just to help with the water retention and whatever else. But I would always say, you know, you need to also make sure you take the rest. Otherwise, very quickly you'll notice the
cracks. Yeah, I mean, and as practitioners, it's an occupational hazard when we see people, because we always like, we scanning, you know, and that's B6, or, you know, that's B2. But the B vitamins do that, unfortunately. So as much as they work together in a team, if you do take them away from the rest of the team, they can mask deficiency, or they can bring on deficiency symptoms of other Bs. I mean, folate and B12 are examples of that. So if you're taking high unopposed amounts of folate, you'll mask a B12 deficiency. So yes, that masking does happen with the B, and that's why it's so important to take them all together. So cortisol, I don't have to tell you anything about cortisol, Em, but for your clients out there, for women, I'm simply put, whilst your cortisol's raised, you're not going to get rid of your belly fat. So I think that's enough of clickbait there for most women just to grab their B5. But the reason for that is because vitamin B5 or pantothenic acid and pantothenine, the other version of it that it gets converted into, is so crucial and so important for cortisol production, but also its regulation. So in any of our patients who are distressed or stressed, had chronic persistent stress, that they've had to deal with, many times it's stresses we can't do anything about. You can't tell them to quit their occupation, or it could be a relationship in their social side where, there's just a chronic stress they have to deal with. Could be financial stress. But anyway, cortisol plays a huge role in that. And now what vitamin B5 does, it maintains what's called the circadian rhythm, which is basically this brain clock that we all have. I think it's called the supranuclear chiasma. So it's like an area in your brain, and it is responsible for making you sleep at night and waking up in the day, in the morning, and keeping things in a rhythm. And vitamin B5 actually is very important. It serves that part of the brain, and it helps the brain to regulate cortisol, so we don't make too much of it and we don't make too little of it. So for patients who are fatigued, who have adrenal insufficiency, patients that you put through the stress program and you find, wow, they are just depleted, vitamin B5 is absolutely essential. It's also very important for the production of neurotransmitters, because as we become more stressed, as we make more cortisol, we do so at the cost of our neurotransmitters. So that's why the more stressed you become, the less well you start to think, and your memory becomes affected. So your ability to make high-end decisions becomes impacted. One of the first things that happens to patients when they stress, they can't make a decision. They'll tell you, I can't make decisions. I never used to be like this. And so that's an indication that there's been a down regulation of all the crucial hormones that are involved with thinking and higher complex thinking. And there's been an upregulation of cortisol, and it's out of sync. So interestingly, with vitamin B5, restless legs at night are a big thing. Muscle cramps at night. We often think of magnesium. And in fact, vitamin B5 loves magnesium. So if patients aren't on a magnesium, I would definitely add it. But cramping in the legs at night, it's not always just magnesium. It could mean that their B5 is deficient, especially if it's coupled with insomnia and restless legs. So I love B5. I know that you've worked with B5 a lot. And
the one interesting note, and I know it was from a questionnaire that Patrick Holford used in his Optimum Nutrition questionnaire to ask about the deficiency symptoms, and people used to tick it. But the one thing that I quite often noticed, not so much recently, but I've always remembered it, is burning feet and burning heels.
Yes.
That, people just cannot. They think it's a circulation problem. They try this, they try that. But if you give them enough B5, that actually goes away. So that was always like one of my things to ask about, like, do you get burning feet? And then interestingly enough, for people who suffer with chronic constipation and years of all sorts of things, when I add in the B5, because we know that a lot of these people also are highly stressed, and you put them on the magnesium and obviously deal with the rest of the diet. But I somehow have always found that B5, probably because of the cortisol and the restlessness and all of that, or maybe it's just intuitively, but I've always sensed that B5 is really beneficial for that as well.
Yes, and for neurotransmitters in the gut, which are so crucial when it comes to regulating the way your gut functions. So interesting, the constipation there. But yes, we do a standalone B5, B6, as you know, it's a product that you recommend a lot. And I've never had a client tell me that they feel ill or they don't feel that it's done something. They always say, oh my gosh, there's so many things that now work since I've taken just the B5, B6. And yeah, I think again, I do think if people are more open to bringing in optimal nutrition and welcoming that into their life, and they begin to supplement very carefully a really healthy, balanced diet, I have seen it in my own practice, the need for prescription medication significantly reduced. I mean, how many people do we know that are on, I think, laxatives? And they've been on it for 25 years. So like simple things like that, can you imagine never having to take that again? And all you needed was a B complex. So that's really the benefit of taking a product like this. And then B12, methylcobalamin is the preferred form. So basically with B12, there's a lot of food sources of B12. In fact, with most of your B vitamins, kind of the themes are animal products are really high in most of your B, so especially organ meat. So if there are people that are doing liver and kidney, but then fish, beef, even chicken, all those products are typically high in B, even things like cheeses, your dairies, and then most of your vegetables, especially green leafy vegetables for vitamin B12. So from a exposure point of view, our foods actually do contain a lot of our Bs, but the problem is that most Bs are affected by applying heat to them. So once you cook the food, unfortunately, the B is lost. And then also, you know, our foods become a little bit more suspect over the years. So people typically are exposed to it, but there are concerns with what they're eating and the sources of the foods that they're eating. And so we just need to be aware of that. And then there are problems within the patient. So B12 is one of those vitamins, unfortunately, that although it's water soluble, many patients struggle with it because they have a lack of stomach acid. So like thiamine, vitamin B1, where GERD is going to alert you to a B1 deficiency. If there is GERD, it will need to alert you to a B12 deficiency because the vitamin B12, as you know, is combined with cobalt, which is a mineral. And you need pepsin, the enzyme pepsin in the stomach, to be able to cleave that cobalt off the vitamin B12. And pepsin is only activated at a very low pH of between 1 and 2. So again, if people are sitting with stomachs that are too alkaline, then they're not going to get pepsin activity and they're not going to be able to absorb their B12. So especially here, your vegans and your vegetarians. So if we do have any of those patients, you know, we often recommend that they do B12. But again, we're not just going to do a single dose B12 or an injection. You can do those, but the patient still needs the whole B complex. And then deficiency with B12 looks like, I mean, we know the symptoms, but for your patients, things like having a pale skin, kind of having that slightly anemic look, and very importantly, cognitive ability decreases. So we find in our older patients, in fact, it's Dr. Eric Berg, I think, that recommends over the age of 55, all patients need to acidify their stomach, either with a little bit of organic apple cider vinegar, which is contains a mild acid like acetic acid, or you can take betaine hydrochloride. And so acidifying the stomach a little bit is going to help, obviously, with your B12 absorption. Also, patients are low in intrinsic factor often. So intrinsic factor is another thing that the stomach releases. The same cells that produce stomach acid produce intrinsic factor. And intrinsic factor and stomach acid and pepsin are crucial for B12 absorption. Now, how many patients are on proton pump inhibitors and acids? So either H2 antagonists, which only block about 70% of those acid-producing cells, but proton pump inhibitors block almost 100% of them. And so the problem we have is that you've switched that cell off. So that cell can't make acid and it can't make intrinsic factor. So for all our patients who are taking prescriptive medications for GERD, they definitely need a B complex and they definitely need B12. And the symptoms of B12 deficiency are not nice. Your cognitive ability goes, delusion, dementia, early onset dementia, blurry vision, neuropathy, the sore mouth and the sore swollen tongue, the fatigue that sets in. So yeah, it's not a nice place to be if you are B12 deficient, but it's luckily something that's easily corrected in most patients, and we just need to watch that stomach acid. So I don't know, Em, do you actually do the bedside bicarb test with your with your patients to look at, to assess stomach acid?
Yeah, I would typically do it if there are digestive concerns, or especially for the clients who've been on the PPIs, and that's really quite common. But there is this perception that you're overproducing acid, and therefore at all costs you need to reduce it. So for me, the clients who've been on the long-term PPIs, definitely will have a variety of nutrient deficiencies, but it's a very easy way to show somebody that either, yes, you are producing sufficient or insufficient stomach acid. So whether it's because they've been told that their indigestion or their reflux is being caused by too much acid, or whether it's after a gastroscopy that they were prescribed something, and we know that PPIs are completely overprescribed, long term, and then people struggle to come off them, and then they just don't wean them off. So for me, sometimes in an attempt to wean someone off, I'll get them to do the bicarb test, and then slowly but surely make sure that we wean them off and that we're supporting digestion sufficiently. And even with the constipated clients, I must say, when I read to them the list of B12 deficiency symptoms, and on the list that I have, and I think some of them are a little bit broader than others, constipation is one of them, but then also the irritability and all the rest. And they go like, oh, I've got all of those. So it's interesting. It's not just a neurological symptom as such, but that digestive tract really needs all the Bs too, especially the B12, the B5, and then like the stomach, with everything else that we've heard. So I like to use the bicarb test, just even to get an idea of where they're at and where we need to support more. And Natasha, we need to sort of move on a little bit in case somebody's still got other appointments after this. So.
And I just wanted to say to that very quickly then is that also apple cider vinegar, I found if patients just take a tablespoon of apple cider vinegar around their meal and they actually feel less refluxy, that's also a quick cue for them that they low in stomach acid and perhaps they need to look at a B. So this is what B12 looks under a photo micrograph, that red crystal, very interesting. Folate also, folate versus folic acid, we did touch on that already, so I don't really need to go into it too much, but I just want to stress that, interesting, if we are deficient in folate, the deficiency in folate causes symptoms similar to that of exposure to ionizing x-rays. I mean, most of us know if you go in with someone to have their x-rays done, you get to stand behind a lead wall while they're having their x-ray done, or they cover your gonads with that lead sheet, because just being excessively exposed to that kind of radiation obviously increases your risk for cancer. So folate directly, a deficiency is going to increase a patient's risk for cancer. And it's something that we're seeing an uptick of now. And I do think, people need to be aware that folate is so essential to not only DNA production or copying of your DNA, but also the repair of DNA. So folate is responsible for helping us repair the DNA in such a way that it's done according to the original recipe. We're not making mutations and changes in the DNA every time we repair it. But it's a very, very common deficiency because of that 5-methyl, because of that MTHFR gene mutation. And again, needs to be taken with B12. And then just to close, I wanted to illustrate this picture, which also seems quite chaotic, but I'm just going to quickly orientate you. So if you can imagine on the inside here, so this is what we call one carbon metabolism, but clients don't really need to know that. This is basically some of what the bees can do, and this is why we recommend it. So inside this little engine here, we've got things like folate, which is your 5-methyl tetrahydrofolate, your B2, your B3, your B6, right? And this little engine spins this way, and it turns this wheel on the outside. So basically converting your protein that you eat, methionine, into homocysteine, which is this thing we spoke about earlier. Now, homocysteine, if it piles up in the blood, is not a good thing. It needs to be converted, recycled through methionine again. So that's happening in our bodies all the time, is that we're going, it's like a little hamster on the wheel that just keeps turning that cycle. Now, why is that important? Because when we recycle homocysteine, we are keeping homocysteine levels in check. So we're going to reduce our risk for stroke if we're a female and heart attacks if we're a man. But you also produce things like SAMe. Now, some of your clients might have heard of SAMe. Years ago, we were able to buy it as a nutraceutical. We can't get it anymore. But SAMe is a natural antidepressant. In fact, they've done some studies with SAMe in a major depression. So it's a really nice product to have on hand for people that don't want to go the prescriptive route, but they want to try something like SAMe. But you can produce your own SAMe. So by just taking your B complex, you can produce your own SAMe. Now, SAMe elevates mood, but it also helps the brain to make other neurotransmitters, so serotonin and melatonin to help you sleep, adrenaline and dopamine. So by spinning what we call the methionine cycle and producing SAMe, not only are you going to control homocysteine and cardiovascular and cerebrovascular health, and you're also going to improve neurotransmitters, which is why when people take a B complex, their neurons come online. They can think, they can memorize, students writing exams, people that are just weary, or your older geriatric group, they can sleep better, they can think better, they're more present. And it's because the methylation cycle or the methionine cycle spins that brain cycle so we can make the neurotransmitters. The other thing I want to just highlight is in the liver. When you're spinning this methylation cycle, you also affect liver metabolism, especially of estrogens. So for any woman who has any PMS, endometriosis, any excess estrogen type of thing, taking your B complex is going to be so good. And then lastly, spinning this wheel is going to help us make that glutathione, so we don't have to go and have IV infusions necessarily. But you can see
thousands at a time. Yeah,
I know, but you can see kind of the complexity. This is kind of oversimplified today, but anyway, and that really actually does bring us to the end. There's not much more other than we've touched on biotin, and this formula does also contain a little bit of choline. And choline is good because choline provides another way for us to directly change our homocysteine back into methionine, which is why choline is so important if there is stroke risk. So if any of us have, especially our mothers or our grandmothers who are slightly older and they risk at TIAs and stroke risk, choline is so important for the nervous system. It converts that homocysteine straight back into methionine, and in so doing, it will then spare all these other B vitamins. But and that's basically the end of my story and my contribution. But I really just want to stress that B complex is where it's at, and I think that's where most people should start. I don't think people should be doing individual high dose Bs on their own in any event, and even if they do so, it's typically for a stated brief period, just to get control of something and just to reset the person, and we typically go back.
But I think for me, I would typically increase the B5 or the B5, B6 during times when we're just trying to restore somebody who's become really depleted. But I think one of the common things, and I thought it'll just be interesting to end with that as well, just one or two of the things that people believe. Very often when you're giving this to a lady, she'll say, no, if I take B vitamins, it'll increase my appetite.
Yes.
So that's one of those standard replies. People believe, no, it's going to give me an appetite. Now, I don't know. I always say, well, if you have an appetite for healthy food and you're going to eat, a sick dog doesn't eat. So if you're not well, you're going to have no appetite. The only way to have absolutely zero appetite is to either be on a fast or to be unwell. So,
and typically that increase in appetite comes from them being deficient in amino acids. So they just start adding the right amino acids, and obviously with the fasting and everything, because when you take Bs, you're going to increase glucose metabolism. So you're going to use up that glucose and the body's going to want new fuel. But it doesn't mean you necessarily have to go for carbohydrates. You can go for...
Can't take Bs because I'll have an appetite, and then you're actually missing out on all the other incredible benefits.
Sure.
And then I had somebody comment on my social media this morning after advertising the talk, and she said she felt really unwell after taking a B12. It was indicated, and then when she did her research, she realized that some people can have an allergic reaction to B12. Now, I don't think it's as much an allergic reaction, but I think what we have learned and what we've been reminded of is that if you're taking one thing, or maybe increasing B12 and not ensuring that you have the balance of the folate and the B1, B2, and all the other things, that you could perhaps have something like anxiety. I have sometimes seen people, especially when they're wearing the B12 patches, thinking that if they leave it on longer than whatever the recommended dosage says, that they start then feeling anxious. So that might be stimulating this homocysteine cycle, or what would your comment be?
So definitely, what we're seeing is sometimes when you give a patient standalone B12, this cycle becomes imbalanced, and you actually can overproduce and overpush the production of this thing called SAMI. So this is why I like pictures. So unfortunately, in about half the patients that have that forced SAMI production will experience anxiety, but even moodiness, irritability, aggression, because SAMI is directly going to increase serotonin, dopamine, but also adrenaline. And so yes, I'm not a big proponent of B12 on its own unless there's an overt deficiency that you've picked up. So you've done red blood cell, folate, you've looked at the B12, and even then you go in with higher doses, but you still support with the rest of the Bs, and I'll tell you why. Because vitamin B3, as you'll see in that inner circle there, vitamin B3 can actually slow the cycle down slightly. So in our formula, the B3 dosage was very high, and this is what you need to understand. So I can only speak to my formula, but in Metagenics, I kind of look at, well, what are the problems that can come up for people? We're trying to make a product to address a large percentage of people. Not everybody's the same, so let's try and preempt what the issues might be and then mitigate that. So the 200 milligrams of niacin in this formula is actually going to slow that cycle down slightly. So even though we're facilitating the production of these intermediates, we're also controlling the speed at which that wheel's spinning, if I can put it that way. The other thing that's very important,
a more balanced way of ensuring that you've got your B2, B3, B6, and then the DHA obviously is something that'll come alongside. But
but also magnesium. So on this picture, I put in magnesium because magnesium bonded to an amino acid called glycine is very important, because the glycine does the same as the B3. If you've made too much SAMI, it will actually slow it down slightly so that you can avoid the aggression. So that's why it is nice to go to a practitioner, because they will obviously plug all these things in. But at the very least, just if you just going out there to buy something, rather go for a B complex. It's safer and it's going to be more effective at the end of the day.
I also just wanted to ask, because I think that's often a question, is B12's absorption orally versus as an injected form or sublingually? If it's in a complex, if it's in the methyl, in this form, is it absorbed orally as well as sublingually, or compared to an injection?
Yes, so obviously nothing compares with the absorption. You can't really compare parental, intravenous or injectable to something like oral. It's just two different routes. It's gonna, you're gonna get much quicker, rapid absorption if you inject it. But typically, because it's water soluble, most people do not have a problem with the absorption of folate or B12 or any of the Bs, but specifically the sublingual B12. The issue comes in if you have a patient with low stomach acidity. So that's where it can be an issue, but it's not because there's an inherent problem with absorbing B12. B12, if we correct stomach acidity, or you take a little bit of acetic acid from apple cider vinegar, you'll absorb it really well. But potentially, if you have patients who are on PPIs and they're vegan or vegetarian, you might want to do a B complex and then still do an injection of B12 or do the sublingual. It just really would depend on what you're seeing. But inherently, we don't have a problem unless we've skewed our stomach acidity. So if you have a problem with B12 absorption, so if you're being exposed to it, but your lab values aren't changing, the problem really sits with you. It's not really the exposure. So you need to then look at, well, what's going on inside. And it's usually intrinsic factor and stomach acid.
Thank you. That was so informative, and it's so nice for me to be reminded of all these incredible benefits and the things to consider. And I hope for the clients who will be watching the recording that this will really help to answer many questions and make you understand things better, and really to go out there with such amazing information the next time you go to buy. And I will be sharing the link of the recording on my social media, and Natasha will be sharing the link as well. If anybody wants to contact me or Natasha, I will just leave my email address with you. It's health, HEALTH, at Emma Mentel, EMMAMentel.com, or you will find me on Instagram as Emma.mentalhealth practitioner. I often post interesting information or updates about courses or talks like this, and it's also just a great way for people to stay in touch with some of the interesting things that we come across every day. There's also a product that Natasha has very generously sponsored for this talk, and I will wait for people to be watching the recording. But if you could then either message or email me with what your take-home message was from listening to this recording, you can message or email me with what that is, and then I'll do a lucky draw for a glycogenics B vitamin complex. Thank you so much, Natasha, for sponsoring that for us, and one lucky listener will then have the benefit of trying that out for the next month or two.
It's our pleasure. Thank you for having me, and thank you for everybody that joined today. And yes, we hope to do this soon.
Thank you so much to all of you who listened in, and thank you so much to those of you who will be watching the recording. I always love these conversations, and we'll keep you posted on the next one, and we will try and have it perhaps at a lunchtime. But like I say, there's always a recording, so you don't need to miss out on the great topic and the information that we're sharing. Thank you so much.
Thank you. Thanks, wonderful talk. Fantastic.
Have a lovely day. See you soon. Thank you.
Bye.